I'll be presenting on the development of the advanced, the Assessing Clinical Ethics Skills tool that we've done at Loyola just over the last year. Can you not hear me? How's that? Is that any better? We have no conflicts of interest to disclose. So the background for the development of this tool, many of you will know, all of you will know in this room, ASBH has moved into a quality attestation process, the pilot phase of that process, in order to look at moving to standardize the competencies that were set for clinical ethics consultants. And so within that context, they're reviewing a pilot phase of portfolios that people have submitted, clinical ethics consultants, and those are generally case write-ups and a philosophy of your approach to consultation. But one of the tricky pieces about ethics consultation is, of course, how do you assess the interpersonal skills that ethics consultants actually exhibit, which is so fundamental to running an ethics consultation. So at Loyola with my colleagues, we have, for a number of years in our graduate courses, run simulated ethics consults in order to teach people how to do consultation. So the beginning of kind of basic level. And we thought, well, is it feasible to actually use the Clinical Skills Center, use the wealth of people we know and have been involved with those, and actually take that and look at a way of assessing the interpersonal skills that ethics consultants actually exhibit using simulation. And so we've looked at ways of developing that. And the idea is that students or clinical ethics consultants would be able to come to the campus, take the course, and actually get videotaped and assessed. And I'm going to talk in just a minute about the tool we've developed to actually assess them. And then they might be able to use that, or they would be able to use that, the video recording, as well as their assessment and rating by experts, as a supplement to their portfolio for the quality attestation process. This isn't required by ASBH right now. We're kind of looking ahead to say what may be coming down the line, what may be helpful in training people, as well as adding that to their portfolio. So the first step, after we had this idea, was to look at tool development. And any of you who've developed any kind of assessment tool will know that this is an arduous process. It's very, we got to know each other really, really, really well. We spent hours together. Not that we didn't already, but it was a very interesting process and very challenging. So there were 4 bioethicists based at Loyola and 1 medical education assessment expert who was involved with the process. We, of course, looked at the few existing tools that are out there and decided that the VA has been doing this for a lot longer than we had, and their tools are well tried and tested. And so we first looked at taking some of the elements from the VA. Some of you will know the Proficiency Ethics tool, which is a very extensive, sort of a 10 to 12 page tool. And the idea is that it's a self-assessment tool for all aspects of the consultation, right? So we weren't going to look at all aspects of consultation. We wanted to look at the actual interaction in the consult, sort of the hot spot. And of course, anything we designed or developed, we wanted that to be based on the ASBH core competencies for obvious reasons. So after many meetings and many discussions among the 4 of us, we selected 12 items from the VA tool as a framework for this advanced clinical ethics skills tool. So as I said, it's not comprehensive for all elements of ethics consultation. It's important to remember that. That's not what we're trying to do. We're looking at specific elements that we could assess in an educational setting where we were using ethics case simulation. And then we identified, once we identified the 12 elements, and that sounds really simple when I say it in a sentence, but it took weeks and hours. We actually then had to do even harder step, which was to identify the specific behaviors we thought we could look at and evaluate, right? It's one thing to say, you know, this is a great concept, this is a great element, but what do we need to see in order to assess that? So it was very in-depth. And in order to do this, we have a whole bank of student ethics case simulations from our basic clinical ethics skills course, and we use those to kind of go back and forth between the iterations of the tool. We would watch the videos separately, we would score them, we would look at the behaviors, we would look at the expression, how we were talking about the behaviors, and what elements we were looking for under each item. And then we would come back together and basically have, try to reach consensus on that. So that was very much a back and forth process. We also referred to Stufflebeam's guidelines for checklist evaluation development. That's used a lot in the clinical setting to give structure to how you do that in the process, and I'm happy to talk about that. So this is a quick glimpse. I know it's a little bit hard to see, but I'll talk through just one or two elements to give you an idea, a flavor. This is, multiple iterations down the line. It may not still be quite finished. I'm not sure when something like that is ever finished, those of you in the audience who've done this. So at some point we will draw a line and say, for now, this is the final version. So we were looking at elements that would be important in a consultation, particularly this live element. So a very simple one, right, seemingly simple, is to manage the formal meeting. So that would be an element that we took from the VA tool. And then we said, okay, what does that mean? So for example, it means as the ethics consultant, that's the person who's being assessed, you need to identify yourself while describing your role in the consult. So it's not enough to just say your name, you need to actually say what you're going to be doing. Of course, you want each party to introduce themselves. Seemingly very obvious, but it doesn't always happen. And then explain the purpose of the consult. And this is, as all of you who do ethics consultation, it can be a little bit tricky, right? What is this? Why is this different than a family meeting? Why are we having this kind of meeting? Why are we meeting again? Why am I meeting you for the first time? I've never seen you before. So consultants need to be able to explain that in a pretty straightforward way, yet give people a clue as to why this conversation may be different. You'll also notice that the categories that can be used here are done, not done, or done incorrectly. Again, many hours of debate. And we selected this based on trial and error, based on revisions, but we wanted to be able to distinguish, obviously, if somebody had met the competency, and we're looking for competency here. We didn't want to try to rate basic, expert, advanced. That's perhaps down the line. But for this level and this first tool, we really wanted to look at, is this person exhibiting competency here? And if not, was it completely not done? Or did they attempt it, but they didn't quite get there? And that's for the educational purpose, right? That's really, we wanted to keep that category for educational purposes because obviously we're going to give feedback to people and say, here's how you performed in this simulation based on these two raters. When these are actually scored and we look at the sort of agreement between the raters, the not done and the done incorrectly categories collapse. So another element which would be pretty crucial to any kind of ethics consult, a lot of what we do is education, right? So item number 8 here, educate participants regarding the ethical dimensions of the case. So some of the behaviors that we want to see are identify the ethical issues, right? Again, sounds simple, but there's some nuance here. You need to use some language which indicates that these are the ethical issues, yet you'll notice the very bottom behavior here says use plain and simple language. So we don't want the consultant to use jargon that nobody understands and throw around beneficence and non-maleficence and autonomy and utilitarianism, and the family's already glazing over at this point, right? So you want to be able to explain what is different here, and you may say autonomy, but then you need to explain what that is. Or you may talk about, beneficence and non-maleficence, but, in a clinical setting, it may be more helpful to talk about benefits and burdens. So there is some nuance there, but we want people to be able to use that language to indicate what is specifically ethical and what those issues are. We also want them, of course, to talk about the range of ethically appropriate or inappropriate options. Right, you're drawing some fences, you're guiding people to say, there may not be one answer here, but there may be a couple of choices that are ethically appropriate. And then sometimes people propose something that isn't, and you need to say, actually, that's not. So you need to guide that conversation. And then also talk a little bit about why these are appropriate or not. So that's the educational piece. So that's an example of some of the things that we'd be looking for. Mediating among competing views. And you may notice there are process skills we're looking at, there are interpersonal skills, and then there are some analytic skills. But in general, we're focusing on those interpersonal interactions. So the course in which we piloted this tool after months of developing it and testing it and evaluating it ourselves and trying to come to that expert agreement, we actually piloted it with 4 of our graduate students. And they did 8 weeks online, and they did 2 days on campus where the simulations actually happened. And we actually used the tool and rated them. They had, in general, for the first case, they had 2 of the trained raters rate them live through a viewing room, and then the other 2 rated them after the event, watching the video, and then we compared to see how close we were or not. For the third case, the futility case, we actually ran that all at the same time. So they had 1 live rater, and then the rest of us rated them by video afterwards. I'm not going to spend a lot of time on the details of the case, but one was a stroke case where the doctor wanted to keep going and the power of attorney didn't, and the other was a more classic futility case where the doctor and team said enough, and the daughter wanted to continue to go. So this was our average observed agreement of this is 4 raters, 4 students, and 3 cases. And you can see, and we did a pairwise comparison here in order to get those averages. And you can see that in general, we did pretty well. After the training, after the multiple discussions and iterations of the tool and what counted as done or not done or done incorrectly, there's a lot of nuance there, and we all bring our perspectives. If you ask a 4 bioethicists the answer to a question, you get at least 6 answers. So we had to work on that. But those discussions, those face-to-face discussions were really important. And you'll see for student 2, there was more variation. So this is about the degree percentage that we agreed on whether this person had exhibited done, not done for each of these items. Because of course the done incorrectly category collapsed when we did this. And as we went back and looked at this, we realized that the second student, there was more variation in the student's performance. And so we realized we needed to do some more training for ourselves because it was harder for us to distinguish. If somebody did it and we could say, oh yeah, that's definitely competent, we had more agreement. But where there were students who maybe were still learning or struggling a little bit more or not, it wasn't as clear that they met a competency, it was harder for us to score it. So we needed to work on what counted in the not done and the done incorrectly categories. So that was about rater training, which we did. We've gone back and we've revised that and sort of tightened that up. But in general, we did pretty well. So lessons learned, simulation, we really feel like this can be a very helpful addition to the whole package of things involved in training clinical ethics consultants, as well as using it in the quality attestation process. It needs to be very focused with clear aims and competencies because it took a long time and we had a lot of that already. So, just a word to the wise there. But it was a very informative and helpful process. It is very resource intensive though. And just a quick note on future directions. We're revising the tool. We also use this tool in a more instructional capacity with our basic clinical ethics skills course. We didn't rate people in the same way, but we gave it as a way for people to look at things they could look at. Are these exhibited in the consult for our basic level students? And they found the feedback from that was very helpful. I'm happy to answer questions about that. They found that really helpful to have some kind of structure and some specific things to look for. And of course, that's one of the broader debates in our field at the moment. And we're looking at ways to refine the tool, publish it, of course, and look at ways of exploring using this tool with other populations, not just our students, but more broadly.